need to ask ourselves, what is a community health worker? And I think many individuals have heard this term in one form or another. There are many different definitions of what a community health worker is. But here in South Dakota, we have adapted the American Public Health Association's definition of a community health worker. Additionally, 20 plus states in the United States have also adopted this definition in hopes that a standardized definition can be established nationwide. And so according to the American Public Health Association, a community health worker is a frontline public health worker who is a trusted member of and/or has an unusually close understanding of the community served. And this trusting relationship enables the worker to serve as a liaison or a link or an intermediary between health and/or social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. So this is our formal textbook definition of what a community health worker is. But if you're like me and more of a visual learner, I think this visual provides a great overview of what a community health worker is, and that the community health worker is the individual who's connecting the communities or the individuals with health and social services systems here in South Dakota. And so the next question we want to ask is, where do community health workers work? And actually, probably an easier way to answer this question would be, where do community health workers not work? Because community health workers are really embedded in various organizations and institutions. So some of the more common areas where community health workers might work are in hospitals or medical clinics, in chronic disease management, as well as in behavioral health, addiction and substance abuse, within insurance companies, and many, many more areas and specialties. So community health workers are really able to work in many different organizations and environments within the community and within our health and social services systems. In addition to looking at where community health workers work, we also want to take a look at the community health worker titles. And here in South Dakota, we are in support of a dual title for community health workers, meaning that individuals can utilize both the community health worker title as well as a title that more closely aligns with the work that they're doing. So for example, if someone is working specifically in a newborn program for parents of newborns, and they're specifically focused on helping with breastfeeding, that individual would be a community health worker if they had completed the approved training program, but might also use the title of a lactation consultant or a lactation specialist. And this really allows the individual to utilize that dual title to not only share that they do have a community health worker training background and that they are a community health worker, but also that they're specifically working with that program as well. So here in South Dakota, we really want organizations and want community health worker programs to utilize that dual title as they see fit to better establish the community health worker within their organization and to provide some better connections to the population served by that community health worker. So next we want to look at the community health worker scope of work. And this is a specific scope of work to South Dakota, and it was initially identified collaboratively between the Department of Health and the Department of Social Services back in 2016. And so the scope of work of a community health worker in South Dakota is broken down into three main areas. The first is health system navigation and resource coordination. The second is health promotion and coaching. And the third is health education to teach and promote methods and measures that have been proven effective in avoiding illness and or lessening its effects. And so I will certainly get into the scope of work a little bit further as we continue to explore community health workers. But next, I'd like to share a little bit of information about community health worker reimbursement through South Dakota Medicaid. In April of 2019, South Dakota Medicaid approved CHW reimbursement. And so this has really opened the opportunity to further introduce community health workers in South Dakota, and has also really opened the door to work with additional payer sources in South Dakota to hopefully reimburse for CHW services in the future. So I'd like to turn the presentation over now to Samantha Hines, who is the Policy Strategy Manager with the Division of Medical Services with the South Dakota Department of Social Services.
So just to give a brief overview of South Dakota Medicaid, we do primarily serve children, and 69% of our current Medicaid recipients are children, but we also serve age-blind and disabled adults, pregnant women, and low-income parents. About 1 in 7 South Dakotans every month has coverage through our Medicaid or CHIP program, and 1 in every 3 children under the age of 19 currently have coverage through Medicaid or CHIP, and about 50% of infants will be on Medicaid or CHIP during their first year of life. So I won't go too much into detail on this slide because Ben's pretty much covered it, but the Medicaid program added community health worker services in April of 2019 with the goal of helping to prevent disease or disability or other chronic health conditions and to help people manage chronic health conditions. Our community health worker services, we have a provider manual that's on our website, and I have a link to that at the end of the presentation. And it's got a complete list of covered conditions, but some of those conditions include substance use disorders, mental health conditions, cancer, diabetes, heart disease. It could also include tobacco cessation and some of those other types of services. But it can also be used for any Medicaid recipient who has a barrier that would impact their health. And the provider would need to do some sort of risk assessment to identify what those barriers are. But they could include things like geographic distance to a healthcare provider or cultural or language barriers that would prevent someone from possibly self-managing a chronic condition. So in order to receive the services through the Medicaid program, they must be ordered by a physician assistant, a nurse practitioner, or a certified nurse midwife. And so that provider would put together a care plan and make a referral for the community health worker service. The service would need to be provided face-to-face by the community health worker. And that can include telemedicine. And we've gotten a lot of questions about that, especially now during COVID. But CHW services can be provided using, a two-way audio-visual component. South Dakota Medicaid does have a telemedicine provider manual, and you can find more information on how to provide those telemedicine services. And so if you refer both to the community health worker manual and the telehealth manual, you can find the information that you would need about that. Services for community health workers can be provided in both individual and group settings. The group settings, however, are limited to 8 people, and that's also applicable if you were to provide the service via telemedicine. So Ben mentioned this a little bit, but in order to get reimbursement through South Dakota Medicaid, the Community Health Worker Agency would need to employ community health workers who have gone through one of our approved curriculums. And right now that list includes the IHS Community Health Representative Program, the Family Spirit Program, which is a home visiting program that was developed by Johns Hopkins, the Better Choices, Better Health Program, National Diabetes Prevention Program, and any of the community health worker programs that have gone through the South Dakota Board of Technical Education or the South Dakota Board of Regents. And right now, I believe Lake Area Tech is the only school that has a program in South Dakota. If there are other curriculums that people would like to utilize, you can contact me. I do periodically review requests from different agencies for different programs, just to make sure that they're meeting, our minimum requirements. And then if it is approved, it can be added to this list for programs that any of your staff could go through in order to get reimbursement for community health worker services. So Medicaid reimbursement, what I've included here is a screenshot of our current community health worker rates. This is for fiscal year 21. And this is updated every year and can be found on our Medicaid webpage, and there's a link to that at the end of the presentation as well. But community health worker services are billed on a unit, and 1 unit is 16 to 45 minutes, and 2 units is anything that's 46 minutes or above. And then the rate that's here on the screen is for 1 unit of service. The community health worker service is limited to 2 units of service on a single day. And that service could be a combination of things. It could be group or individual services. The other thing to consider here is that there is a limit during the plan year, which is July 1 through June 30th. And a recipient is limited to 104 units of service. So just something to keep in mind when you're working with Medicaid recipients. Just a quick little note here about our Medicaid portal. Providers all have access to this portal, and you can use it to check the status of any of your claims or submit claims. And then important for community health workers also is to check the eligibility of recipients. Sometimes there are community health worker programs, like the diabetes prevention program, that might go for a significant period of time. And the provider would need to check every month to make sure that the recipient is eligible for every month of the National Diabetes Prevention Program. It's pretty common for Medicaid recipients to have eligibility 1 month and to lose it the next month, and then for them to get back on. So a recipient does need to have Medicaid eligibility in order to get reimbursement for the service. And so a provider would just need to check the portal whenever they're submitting claims to make sure the recipient that they're billing for has Medicaid eligibility for that month. And if you need more information on how to use the portal and how to check eligibility and submit claims, we do have a manual on our website that would walk you through how to do that. So a little bit of information about Medicaid enrollment. So anybody who's interested in becoming a community health worker agency through Medicaid would need to fill out our provider application at the website that's listed on the screen. So that all providers have to go through that process. But then there's an additional supplemental addendum for community health workers that would need to be filled out and signed. And that addendum details some of the policies and procedures that would need to be submitted to the Medicaid office for us to review. And that's part of the enrollment process, and how to become a provider is our review and approval of those policies. So a complete list of those policies, it's actually on the next slide, but it's also in that supplemental addendum. And also, just for clarification, we don't enroll individual community health workers. We would enroll the agency. So, for example, say Avera wanted to become a community health worker or had a community health worker program, Avera would be the one to enroll, not the individual people who Avera had employed to provide the service. So this is a list of all of the policies that are part of that supplemental agreement that would need to be submitted. Really, all of these policies are things that agencies usually have in place already. If anybody is interested in becoming a Medicaid provider, I do have some additional resources that I can send that detail more of what the content that we're looking for in the policies, if you'd like to take a look at it before starting your application. I'm also available to provide technical assistance. I had, before COVID, been doing some face-to-face visits with different providers to walk through the enrollment process and to go through policies, but I am available virtually to do that as well. And my contact information was at the beginning of the presentation, and you can feel free to contact me at any point. So here's some of the resources that I had mentioned, our portal, our billing instructions, the fee schedule, and our community health worker manual. And I will be on for the rest of the presentation, so if there's any other questions that you all have about Medicaid reimbursement or Medicaid enrollment for community health worker, please feel free to ask.
I want to go ahead now and share some additional information about the Community Health Worker Collaborative of South Dakota. So I'm going to take a few moments to go through and share more information about the Community Health Worker Collaborative. So the Community Health Worker Collaborative has a mission of promoting, supporting, and sustaining the community health worker or CHW profession in South Dakota. And our ultimate vision is a well-established statewide network of CHW professionals who provide a wide range of services for South Dakotans. So first, I want to provide a little bit of a timeline as to how the organization came to be. Back in 2015, the South Dakota Department of Health conducted an environmental scan and statewide analysis of the CHW workforce in South Dakota. So that included not only connecting with organizations to understand their current community health worker or community health worker-like programming, but also connecting with organizations across the state to understand what a future community health worker program could look like. And then in 2016, as I mentioned prior, the South Dakota Department of Health and the South Dakota Department of Social Services co-facilitated a work group to develop key recommendations for community health workers in South Dakota. And then as Sam introduced us to this, we now have CHW reimbursement as a covered service of South Dakota Medicaid starting April 1st of 2019. And so to further expand the community health worker profession and to really develop community health worker programming across South Dakota, the South Dakota Department of Health established the Community Health Worker Collaborative of South Dakota to promote and develop the CHW workforce in South Dakota. And so I'll reference this a couple times throughout today's presentation, but really what we found is that South Dakota is a little bit behind other states when it comes to community health workers. And so thankfully there are many resources available across the United States, and many states that are really focused on developing community health workers or already have developed strong community health worker programming within their states and are able to lend a hand and provide insight and information to South Dakota. So I wanted to also take a moment to share our 5 areas of focus for the Community Health Worker Collaborative. The first area of focus is awareness. And so this really involves introducing the CHW profession statewide. So this webinar is a great example of how we're introducing the CHW profession to individuals and organizations within South Dakota. And then we also want to explain and summarize the CHW profession and be able to correctly share the definition of a community health worker, and then also share community health worker success stories. Community health workers are individuals who are working with many vulnerable populations and many individuals who may be having some troubles accessing healthcare or understanding their healthcare. And so we really want to share those success stories and really be able to share with other organizations and individuals the great work that community health workers are doing in South Dakota. So as far as our summer 2020 activities, we have launched the Community Health Worker Collaborative website. And so feel free to take a look at that. It's CHWSD.org, and it provides a lot of additional information about community health workers. And then we also are soon to launch our South Dakota CHW Planning and Assessment Toolkit. And this is a great 4-module South Dakota specific toolkit, which will be launched in late summer of 2020. And then we're also going to be able to offer continuing education for that 4-module South Dakota specific toolkit. So that toolkit is just in its final stages of being developed. The Cardiovascular Collaborative through the South Dakota Department of Health has really taken the lead in developing that toolkit along with Emory University, and that will be available late this summer. And then we also have our statewide introduction to community health workers, and then a community health worker workforce survey, which launched in August of 2020. And I'll share a link to that survey at the end of this presentation in the chat box. And if you haven't already responded to that workforce survey, please take a moment and respond to that survey on behalf of your organization. This will help the Community Health Worker Collaborative to better understand the needs for community health workers and community health worker programming moving forward. Our next area of focus is on training, and Sam mentioned this a little bit already, the current training programs that we have available in South Dakota. But really what the Community Health Worker Collaborative is looking to do is to promote the current CHW training program and then assist organizations in developing additional community health worker training programs, and then promote the community health worker training opportunities to non-traditional as well as traditional students. So right now in South Dakota, we have 5 training programs. We have 2 training programs that are here in South Dakota that are more of a general community health worker training program. One is through the Lake Area Technical College in Watertown, South Dakota, and it includes 3 different options: a CHW certificate, which is the equivalent of a semester-long training program, and that's offered completely online for students wishing to enroll in the CHW certificate program. And then there's also a diploma option, which would be a 1-year training program, and then also the opportunity to build upon that certificate and diploma and receive an associate's degree as a community health worker. And that's especially important when individuals are maybe looking to expand their education and continue on past an associate's level. But we certainly recognize here in South Dakota that the CHW certificate more than qualifies an individual to provide CHW services and really sets them up for successes in the CHW profession. And then South Dakota is also able to work with the Indian Health Service Community Health Representative Training Program. That's also a current CHW training program that we have here in South Dakota. And then in the more specified areas, we have the Family Spirit Home Visiting Program, the National Diabetes Prevention Program, and then also Better Choices, Better Health South Dakota and their lay leader training. So as Sam mentioned, there's also an opportunity for individuals who may have completed a community health worker training in another state or through another program to submit more information about that training program and then have that training program looked into. And additionally, I've been working closely with the other technical colleges in South Dakota to introduce them to a community health worker certificate training program opportunity. And then there's also further opportunity for healthcare organizations and other specified community health worker training programs to possibly come up with community health worker training programs in the future. Next, we want to look at workforce development. So that's not only promoting the CHW profession, but also promoting the CHW scope of work, and then promoting the integration of community health workers into medical and social service organizations. And so since starting the Community Health Worker Collaborative in January of 2020, we've really done a lot of behind the scenes work to better understand what community health workers look like on a national level. And so we initially reviewed the CHW workforce, community health worker associations and organizations, et cetera, in all 50 states. And after conducting that national environmental scan, we identified 9 programs or 9 states that most closely align with South Dakota and or are programs that we want to model after or strive to be like. And so those 9 programs, Florida, Massachusetts, Minnesota, Nevada, New Mexico, Oregon, and Texas, as well as also looking further into the IHS or Indian Health Services, CHR or Community Health Representative curriculum. And so to give you a quick example of a program that South Dakota is looking to model after or strive to be like would be Massachusetts. They're one of the states that was the first to implement community health workers within their healthcare and social service organizations back in the early 2000s. And so community health workers are really well embedded in Massachusetts, and individuals are really able to connect and work with community health workers in Massachusetts. And then a state that aligns or looks similar to South Dakota would be states like Arizona and New Mexico that have a well-established community health worker workforce. But if you think of it at the same time as Arizona and New Mexico being almost a copy-paste of South Dakota, but with a larger population and also a much warmer climate, Arizona and New Mexico have some urban areas, some rural areas, some frontier areas, and also a large tribal population and tribal reservations within their states as well. So after conducting the national environmental scan and really narrowing it down to those 9 programs, I was then able to work with and interview each of those different states and better understand their successes and what work they've done that has really helped propel the community health worker workforce forward. And then we also have our statewide introduction and workforce survey, which is really focused on current CHW and CHW-like programs, as well as future CHW programs. And so if you haven't, again, already responded to that survey on behalf of your organization, please take a moment to respond to that survey. Many of the questions are similar to what was asked on a smaller scale in 2015. And so we're really excited to be able to collect that data and help the Community Health Worker Collaborative and the community health worker profession move forward. The next area that we want to focus just a little bit on is reimbursement. And reimbursement, as Sam mentioned, is already available through South Dakota Medicaid, but the Community Health Worker Collaborative also wants to work closely with other payers to cover CHW services. And through our nationwide environmental scan of the other 49 states, as well as through interviews with our key states that we've connected with as well, we have found that Medicaid reimbursement kind of leads the way for other payers to cover CHW services as a reimbursable service, whether it's through private insurance or other payers. So reimbursement is certainly something that we'll continue to work on and continue to work with other payer sources in South Dakota to better expand the community health worker reach within South Dakota. And then along with reimbursement, we also want to take a look at return on investment and the return on investment that community health workers can provide to programs and organizations. And then the next area we want to focus on is looking into career ladder as well as a career lattice. And so not only promote career advancements for community health workers, but also promote cross-training of community health workers to other positions or trainings. So when looking at a CHW career comparison, this is something that we're working on developing now, and we'll have on our Community Health Worker Collaborative website in the next month or two. And it's really taking a deeper dive into what other positions are out there that may compare to the community health worker profession. One question that I've been asked, and I know that's a concern on a more national level, is that community health workers might come into an organization and take over work that someone else is doing. Maybe it's a medical assistant or an LPN or an RN or a social worker. And what we really want to emphasize through the Community Health Worker Collaborative is that there's always a place for the community health worker to come in. And that might then open some opportunities for that individual who was doing some of that community health worker work to then better focus on the areas that they're trained for or their scope of work. So for example, we might have a registered nurse who may be doing some patient navigation for a patient, or might be helping them to find a provider or seek an appointment with a specialty provider and get things scheduled and arrange for transportation. But a community health worker would certainly be prepared and able to do that work, and then the registered nurse could then focus on other registered nurse duties. So ultimately what we want is community health workers to be able to work within organizations and not take over other positions. And so this comparison will really provide more information as far as the scope of work for similar positions or professions and how community health workers can work and enhance the work that those individuals are already doing. And then we also want to promote that the community health worker work is a profession. And so we really want to let individuals know that if you are a community health worker, it's certainly not frowned upon if you are a community health worker for 20, 30, 40, 50 plus years. And we've seen this through the community health representatives through IHS programming, and that they have CHRs who have been working for 20, 30, 40 years since IHS introduced community health representatives back in the late 1960s. So we really don't want to look down upon the profession. We really want to recognize it as a strong and growing profession in South Dakota, and really as a collaborative provide that support for community health workers. And then we also want to look into promoting community health workers into management. So as community health workers start to build up and build programming in South Dakota, we really want the individual who maybe started out as the single community health worker within an organization to then be able to step up and manage a community health worker program that may have 2, 3, 4 or more community health workers within their organization. And then we also want to look at helping community health workers expand their knowledge base into specialty areas. So maybe it's helping a community health worker take additional courses on diabetes as the community health worker is transitioning from a primary care clinic to working in a diabetes self-management education program. Or maybe it's helping a community health worker to attend a national asthma convention as they specifically work in a pulmonology clinic with patients with asthma. And then the other thing that we want to look at too is the career lattice for community health workers, specifically in more of our rural areas. And this is something that some other states have been looking into as well, is if we have a smaller community where there may not be a full-time 40-hour position for a community health worker, we can instead have an individual train as a community health worker and also train in a different area, whether it's as a CNA with a local nursing home or an EMT with a local ambulance service, and then be able to pair those positions together so that the individual can then have a full 40-hour work week, stay in their rural community, but also be able to work as a community health worker and also meet some of the workforce needs in the community in other capacities as well. So to wrap up today's presentation and look into next steps for community health workers in South Dakota, there's a couple different things that you and your organization can do to help the community health worker profession continue to build and expand within South Dakota. Obviously, one of the easiest steps is to really educate yourself on community health workers and fully understand community health workers. So I hope today's webinar provided some further insight and some further information about community health workers and the work that's just starting here in South Dakota. But specifically, I want to look at 3 different areas of 2020 work that we can work together to complete. And that's the CHWSD workforce survey with the link in the chat box. And then also there will be a link in the chat box as well so that you can sign up to periodically receive communication from the Community Health Worker Collaborative of South Dakota about upcoming opportunities and CHW training opportunities and a quarterly newsletter, which will start up this fall, and other important information that will come from the Community Health Worker Collaborative to better support and sustain the workforce here in South Dakota. And then in late October, early November, the Community Health Worker Collaborative is also going to host a strategic planning session. And this is open to all individuals and organizations, and it will really help to develop a Community Health Worker Collaborative of South Dakota 3-year strategic plan. And so that strategic planning session will be held virtually due to COVID-19, but we would certainly welcome any and all individuals and organizations to assist in that strategic planning process. So if you're specifically interested in participating in that strategic planning process, please don't hesitate to reach out. And I will also share further information as we get closer to the late October, early November timeline for our strategic planning process. So with that, I just wanted to thank everyone for attending today's webinar. And I have noticed that throughout today's webinar, we've had some comments pop up in the chat box. And so I will now take a moment to once again thank Samantha with South Dakota Medicaid for sharing information about Medicaid coverage for community health workers, and then also thank all of you for attending today's webinar. And with that, I will go ahead and open it to questions. Sorry, I'm just scrolling through here to see what questions are available in the chat box here. And so one of the questions that we have is, what are you seeing from payers other than Medicaid regarding reimbursement? And so that's a very good question. Here in South Dakota, we're a little bit early on in developing the community health worker profession. And so we don't have a lot of community health workers yet within South Dakota. But from other states that I've connected with, Minnesota being a prime example and our neighbors to the east, is that once Minnesota Medicaid covered CHW services, then some of the other payers within the state, specifically some of the private insurance companies, jumped on board as well to cover some community health worker services for their insured population. So I think as we continue to build up the workforce and build up the profession, we'll be able to then have some South Dakota specific examples and successes and data as well that will help us to better make the case to other payers as to why they should cover community health worker services. And then on a national level, a new association has just formed in the last year or so. It's the National Association of Community Health Workers. And one of the areas of focus that they're working on is really helping to jumpstart and build up the community health worker profession on a national level. And so right now it's more state specific, but making it and raising more awareness about it on a national level. And so I think that will help as well as we continue to get more national awareness about community health workers, and as other states are also in the same boat that South Dakota is in continuing to build up community health workers.